Hello, and welcome to Cape Wellness Week. We have the honor of having Dr. Joe Shapiro here to discuss with us the topic of peer support. Thank you very much, Dr. Shapiro. It's an honor to have you.
It's
Uh,
a pleasure to be here.
I was wondering if we could start off with a short introduction, if you can go ahead and share.
Sure. So I'm a surgeon, head and neck surgeon. I'm associate professor of otolaryngology-head and neck surgery at Harvard Medical School, and when I was at Brigham and Women's Hospital for much of my career, I started the Center for Professionalism and Peer Support, and directed and led that for about 10 years. I'm now affiliated with Mass General Hospital. And I'm a consultant to the Department of Anesthesia, Pain, and Critical Care, and I'm also principal faculty for the Center for Medical Simulation in Boston.
Amazing. Thank you so much. So we're here today to talk about peer support. Would you be able to share a little bit about peer support and what purpose does creating a peer support team serve?
Yeah, I mean, the idea of peer support came from actually looking at other groups like first responders who have very robust equivalents of peer support. They have a bit of a different model. And we, a group of us, when I was at Brigham and Women's Hospital, did a study to look at what exactly, what could we do to improve resilience, which can be defined as growth through trauma, the trauma being the acute and chronic stressors that we face in the profession of medicine. Because what we noticed was that there really wasn't much attention paid to how we were doing as healthcare providers, and in general, not just physicians. And it was really just a beginning of this, some of the data coming out about burnout and suicide in the medical profession. And so we wanted to understand, like, well, what can we do to cope with and mitigate some of the impact of the stressors that we do face? And one of the things that we learned from the study was that when we asked specific questions about specific stressors, where would you want to get support from, the vast majority of the physicians we surveyed wanted to be supported by a colleague. And there was another study I was involved in that validated that as well. What helps people become resilient, that is, move through and cope with stress of things like making a medical error. One of the factors includes talking about it with colleagues, and this very important sense of community that I think in medicine can get lost because of the way we practice, and that's understandable. We're not going to change practice patterns, but we can start programs that actually pull on the collegiality and sense of community that we all really thrive in.
Absolutely. So on the topic of peer support, when would be the right time to launch a peer support team?
Now, I think that I actually authored an article in one of our head and neck journals, as a matter of fact, that said we have enough information to act. There is enough data. First of all, there's so much data showing that we have in our profession, extremely high levels, unacceptable levels of burnout, depression, and suicide. And so I think the recognition globally is we've got to do things to mitigate that. We have to do things to actually improve the well-being of those of us who are giving care to patients. And so that data is there. We can't go on the way we've gone on in the past, which is just, assuming that we're what I call an inexhaustible resource, and that our needs don't matter. Now, of course, the needs of our patients and our families and many other people acutely, of course, take precedence. And generally in our lives, we're altruistic. That's why we went into the profession. There's an overall theme of giving, but that's not sustainable on the long term if we never pay attention to ourselves and to our well-being as a profession, as colleagues, and individually. And so I think there's no question that we have to be engaging in programs that improve the well-being, our well-being. We don't nobody really knows, of course, what's the perfect program in terms of well-being programs, but there's never going to be a perfect program. I think we know that. And I think that given that we have the data showing this, particularly around addressing acute and chronic stressors, that one of the things that can be helpful is peer support. We should start doing some of those programs. I'm not saying only do peer support when we're doing well-being programs, as you know. You're an expert in this as well, but peer support as one way of addressing these acute and chronic stressors from understanding the data that has been generated. So now there should be absolutely no reason not to start it now.
Mm-hmm. You've made quite the case for peer support. I guess my next question would be, what are the basic steps involved in creating a peer support team? And maybe could you share some resources that are available?
Yes, and here, of course, my disclosure and bias, you have to hold that as you're listening to me, because a couple things. First of all, I self-identify as a surgical educator, and I do tend to feel like, when you want to do something, especially something that has a big culture change attached to it, you have to you have to educate people and help them overcome barriers to doing what turns out that that can be the most helpful to them. So you have to, hold that as I'm speaking. But I think one of the most important components is actually making sure that whatever healthcare organization is doing this, whether it be departmental or a national group or a specific hospital or a healthcare network, that the people who control the resources are resourcing this program. Because one thing that has come out in the literature is that if you're going to, then when they looked at these authors looked at lots of different well-being programs, they concluded from their research that the ones that are most effective are ones that are actually resourced organizationally or are driven organizationally. So I think you need to have the organizational leadership on board. You need to have the people who are aware of stressors like errors, patient aggression, litigation, those sorts of things, who's been working on COVID wards, the chronic stressors as well. You have to have those people on board to be able to refer to whoever is running the peer support program. You have to pick a person to run it, and then some administrative support. And then it's pretty simple from there, which is you want to get a group of peer supporters nominated by peers and then train them. And because we're training people to go from doing informal peer support, which most of us have done, to doing a more formal peer support. And there's some subtle but important differences between that. And then a big component of being a peer supporter is destigmatizing and facilitating referrals for further resources, should the peer desire them. Because as you know, there's a lot of barriers to our being willing to say, I'm hurting, this happened, or this is happening, I need help. And you have to design programs that overcome those barriers. So part of designing a peer support program is making sure that people are trained to do reach outs, and that the organization is set up to hear about things so that I, the peer supporter, could be contacted to reach out to you because there's been an event, and then offer that support in the way that doesn't make you feel singled out or in a negative way, or in some ways have your privacy invaded. So again, that has to do with the training and how you set up the peer support program. You get people trained, and then you actually support the supporters by bringing them together periodically. Now we've been doing everything virtually, and helping them, feel supported themselves, and also do some practice in doing peer support, and be there for them as a community.
Mm-hmm, mm-hmm. Excellent, thank you. Are there any possible risks in creating a peer support team?
There are theoretical risks. I'm going to rephrase that question if this is okay, and if I've missed what you want, you can ask your part again. But I'm going to frame it as: are there risks in doing peer support, in providing peer support? And I think there are theoretical risks. And so one of them, for example, is if you're supporting for something like an adverse event, especially if there's an error, the theoretical risk is if that person who you're supporting then becomes a defendant in a lawsuit, several years down the line, that conversation in many states in the US and many countries isn't peer protected. What it isn't in Massachusetts, for example. And so we had to decide, how do you design a program that doesn't end up causing harm to somebody? And there are very specific ways of doing that. So just as an aside, I've helped over 100 different healthcare organizations throughout the, different countries and many states in our country develop peer support programs. So you have to be able to allay the fears of, for example, legal and risk management, that to make this them feel comfortable going forward with peer support. So that's a theoretical risk. By the way, any risk is, I believe, outweighed by the significant risk that is very well documented of not supporting each other. We know that. That's what we've been doing for years, the not supporting. So you have to, just like surgery, you have to look at risk benefit. And so another theoretical risk would be if a peer discloses that they're, for example, suicidal or have some risk of impairment, what's the role of the peer supporter in terms of either duty to report or liability or what have you? And again, it's a theoretical risk. I haven't ever heard or seen this come to fruition as a risk. But it's why we talk about it in doing training, so people understand what the boundaries are. We're not therapists. Nobody would mistake me for a therapist. We are there to provide emotional, psychological, but emotional first aid. And as such, we're not there to do a suicide screening. We're not there to, to judge whether somebody needs, is actually impaired based on how much they've told us they're drinking. We are certainly going to ask about suicidality, for example, the way I hope we all would ask a colleague if we're worried about them or just we're in a position to be checking in with them. Which doesn't put us in a legally liable position of like, well, you've asked about it, now it's your responsibility to make sure it doesn't happen. And it's the same thing true in peer support. You're not in a therapeutic relationship with somebody, and so you're I think you're morally obligated as a colleague to check, but that's very different from any kind of legal or medical liability. So we talk about boundaries in training and making sure to stick to those. And then, I also worry, if you will, that you might want to call it a risk, that, I don't want to burn out the peer supporters. So you need to make sure you're not asking people to do this often enough that it would be problematic for them. And so you want to train enough people that you can share the responsibility, and I might add the joy of doing peer support, because it is quite joyful to do. I have to say it's intense, but really, really replenishing and rewarding to do peer support. So you want to make sure you don't ask people to do it too often, and then also that you do what I alluded to, which is support the supporters in whatever way is important to them.
Mm-hmm. Excellent. That leads me to my last question with regards to supporting the peer supporters. Any specific ideas? I mean, obviously it's going to be virtual, but any specific ways to support the peer supporter?
Yeah, I think there's so many. You can be really creative. It depends on what your community views as being honored. Like, how can you do that? Because generally speaking, it's not by giving them $100 to do each peer support intervention, and there's behavioral economic reasons not to do that. But I think the most important thing is to make sure that the person running the program is available if any of the peer supporters has a concern or question about the peer support intervention or what have you. The second most important thing is to make sure the peer supporters know that if for whatever reason, when they're asked to do a particular peer support, that they don't have the bandwidth, or for whatever reason that they absolutely say no and no questions asked, just that's fine, no problem, we'll call on you another time. And third, it's to bring people together now virtually as a community, so they're being supported, that you do a debrief, that facilitate a debrief where you're really there to hold what's happening for people, and also to get them, as I said, a chance to practice peer support if they want to do that. And last but not least is, what is it that would make people feel honored? So is there a ceremony at the end of the year where peer supporters are honored by the department or the hospital or the healthcare organization? At Harvard, like we like, people should be able to put this on their CV as a citizenship, activity that they do to give back. And so I think those are really important ideas.
Excellent. Well, thank you so much for your time, Dr. Shapiro. It was lovely speaking to you and learning from you. Thank you for all of your sharing all of your experience and for really advocating for peer support. I think one of the big takeaways from this conversation is when I asked, when is the right time to launch the peer support team? And you said the time is now. So thank you very much for sharing. Any closing words to share with the CAPE?
I want to acknowledge your leadership and commitment, because this is how things happen in medicine and generally, and the world, I would guess, as well as individuals say, this needs to happen, and let's move forward and do it. So thank you for that, and also thank you to any of the peer supporters out there who've been trained and are doing the work. It's we need each other, we really do. Thank you for having me.
Thank you very much.